Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about what are the tasks that medical coders perform. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so I got this comment. Well, it's not a comment, it was an email from one of the viewers. Thank you very much for sending this question in. I'm going to read the question and we're going to get into it. So here we go. So the viewer says, I am currently watching your latest live stream and you are speaking about employers and interviews. I find so many job listings, medical coding needed, and yet they list must schedule appointments, greet patients, coding for physicians, and sending claims and managing AR. It looks like they're incorporating 3 jobs for the price of 1. Absolutely. In this instance, they absolutely are trying to incorporate 3 jobs into 1. You have to be careful when you're out there applying, okay? I'm going to be very honest about that, all right? This place is obviously some place that doesn't understand what we do as coders. A coder will never be on the phone scheduling appointments and doing all that stuff, because that is more for somebody that's running the front desk or a secretary or something like that. Those are the tasks that they do. There's a lot to doing what we do as coders, and we have to have the time to focus on it. Again, we have many hats, and I'm going to talk about some of the things that we do. But just so you guys know, it is possible to just have a job that is only medical coding. How do I know this? Because that's what I do. I have never billed. I have never submitted anything to billing. I've never done prior authorizations. I've never done appointment scheduling. I've never done follow-up. I've never done collections. I've never done any of that. I have always only done coding. I've coded for the outpatient side for 15 years. So it is possible to get a job this way in just coding. Now, it's when you are working for smaller doctor's offices that they try to do this to people who want to do the coding, because they don't really understand. And what they do a lot of times, it's usually the spouse that's doing the office manager role, and they usually will rely heavily on their electronic health record to select the codes. Or maybe the provider says, well, I know I always select these codes, they always get paid, we're fine. No, actually, that's not correct, because a lot of times what happens is these codes get updated every year, and the rules change quite frequently. And even the insurances have different policies about different procedures and different diagnoses and things like that. So there's a lot of things that change constantly. And it's not a good idea to work at a place where they don't quite understand that, okay? Because again, if the spouse is managing all of that stuff, there's a lot of things that happen. I've heard many horror stories, and I've always said, if you're going to apply at a place, go for a bigger place like a hospital. And working at a hospital doesn't necessarily mean that you have to do inpatient coding. Okay, I've never done inpatient coding, like where they're staying in the facility. I know my way around inpatient coding. I can do it from a book, obviously. But when it comes to working in a hospital, there's the ER, there's professional fee coding, there's clinic coding, and then of course you have your inpatient coding, which is the ICD-10 PCS and all that stuff. So there's a lot of things that you can do at a hospital. But the great thing about working at a hospital is you have a lot more variety that you can get into versus working for a private doctor's office, and it's a lot smaller of a group that you have to work with. And then oftentimes you're going to be doing a lot of different tasks like greeting the patients and scheduling appointments and doing all these things. This leaves very little time for the actual coding. So be very aware when you are applying for jobs. What are they asking you to do? So these are some of the things that we do as coders, okay? First and foremost, when we are coding, we are looking at documentation, and we are either auditing the pre-selected codes that are already selected by the provider, because sometimes the provider will do that depending on the electronic health record. Sometimes the codes will already be selected. So basically you're going to go through it and you're going to audit, okay? And just basically make sure that those codes match up with what is in the documentation. If they do not, then you have to change them to reflect what's in the documentation. Now, there are some facilities that have rules about that you can change the codes, but you have to email the provider. I never understand that because the providers are not meant to be coders. That's why we have a job. And so that's something that you'd have to work out with your facility. But I'm just saying that that's something that sometimes happens. That's a waste of time, really, because then you would have to explain it. And then if you're doing this a lot, then that means that the provider needs education. And a lot of times the provider is going to select whatever is most easiest for them to select in the electronic health record, because that's why they have a coder to fix it if it's not right. Okay, so we are reviewing the documentation, we are selecting the appropriate codes or auditing the codes that are selected, and sometimes they're correct. And sometimes we can just fly through those, and that's okay. But other times we have to look, and sometimes, especially if you are coding for injuries, a lot of times those codes are not going to be correct unless you have spent a lot of time with those providers and they do a really good job at, knowing when is the initial, when is subsequent, when is sequela, and that kind of thing. So when you're looking at these documents, that's what you're doing. You're auditing, you're looking at the documents, you're making sure you're sending queries. You send queries. Now, queries is if there's a question about what is going on in the documentation. Not like with their treatment plan or anything like that, but something in the documentation is conflicting. Sometimes they may have it in the HPI or the history of present illness that the patient injured their left knee. But when you go down to the assessment and plan, it says the patient was treated on the right knee. So you see how there's conflicting documentation there? That would have to be sent back to the provider to query and find out which side is the one that is receiving the treatment. And if they need to go in and make a correction, then they can do that at that time. If there is something that is missing that's going to let you know what happened in this encounter, that's the thing that you have to also query them for. Like if there's something missing in the procedure portion, right? What medications did they inject and things like that. So those are different things that you're going to be encountering when you're out there looking into documentation. Now, sometimes people think that, well, here's our super bill, and a super bill is basically a list of a lot of common procedures and common diagnosis codes, and they go through and they check them off. They think that getting those codes from that super bill and then entering them in, they think that is coding. That is not coding. That is data entry. There's a big difference. The variable here is when you actually look at the documentation. That's when the coding happens, okay? So just make sure that you're not going into that trap of, well, here's our codes, and you're just going to enter them in. And that's all you do. That's data entry, okay? Or they call it charge entry. That's something that's different, all right? That's not coding. So pay attention to that as well, because again, a lot of times people don't know what we do. They don't understand the full role of a medical coder. And again, it starts with reviewing the documentation and making sure that everything's there, making sure the note is signed off on appropriately, that it's dated appropriately, and all of those things. So that's something that you really have to pay attention when you're in these interviews. Ask them that question. If when you are ask them to walk you through the process when you're coding, that you look at the electronic health record, and then you're going to go through and then you're going to do the coding, or you're going to audit the codes that are already selected. You're going to add codes. What happens if you have to change codes? Do you just change them, or do you have to email somebody? So at least that way they know that you're aware of what is happening, okay? All of this stuff takes time. Not only that, when there are updates every year at the beginning of our coding new year for ICD-10-CM, the new guidelines get released in October. October 1 is when they get released. So if there's a lot of changes that happen, you have to go and educate your providers. And that's another thing too. Sometimes it's not the coders that are doing the education, but they do have an in-house coding educator that goes and educates the providers. Not everybody has this. So if that is part of your duties, then you want to make sure that you are saying, okay, well, I'm going to educate my providers. Again, this takes time. So you wouldn't have time to sit there and call patients, schedule appointments, do, accounts receivable. You don't have time for that. That's why there's a coder and a biller. Depending on the size of the practice, though, sometimes it is the coder and the biller. It's one person that does the job of both. You know, they do the coding and then they submit the bills to insurance. That is a lot of work for one person. But again, if it's a smaller practice, then that's okay. But you don't really want to get yourself in that, especially if this is your first time out of the gate. You want to pick one or the other. You want to pick billing to start with. Now, the difference between starting with billing or starting with coding. If you start as a biller, this is a good way to introduce yourself to these codes because the codes are already going to be selected. The procedures, the diagnosis, the modifiers, and the sequencing is all going to be all done for you. All you have to do is just learn how to enter the information in, do the charge entry, and then send it off to the insurance company. Then the insurance company will send it back. If there's a problem and they deny it, you can look at the encounter, or you can look at, you know, what it is that they're saying that they're denying, and then you either send it off to the coder or you have to fix it, okay? And again, that's the person that does the billing and the coding, okay? So if you're doing that, then you have to look at it like, okay, why did this get denied? And a lot of times you're working with an encoder. So an encoder is an electronic code book. And the great thing about an encoder is that when you punch in codes, and if there's an edit means that there's something wrong with the codes that are selected. Either it doesn't apply because there's a gender mismatch, like sometimes there's female codes and there's male codes. And if for some reason these codes got mixed up, right? You wouldn't be able to put certain codes with certain things, okay? So, or if it's a pediatric code and it's an elderly patient, those are things that happen. So an edit will pop up and say, review these codes or something like that. Or it'll say you can't do this, or this is excludes 1 or excludes 2. It'll tell you what's wrong. And so that's when you can decide, okay, well, this code didn't go together, so I'm going to take this code out, or again, you may have to send it off to the coder. But if you are doing that, that's how you would look at that and to see, you know, what is going on. If it is a modifier issue, sometimes the modifier is missing. They will have a minor procedure done and they will have an E&M done in the same visit, and the E&M was for a separate condition, so that would get a modifier 25, and sometimes it gets sent off without the modifier 25, or maybe something happened with the system and that it didn't recognize a 25 and it dropped it off of there and it submitted it without it, and the insurance denied it because there should be a modifier 25. And so then you add the modifier and you send it back in for payment. So that's starting off as a biller. And again, the pressure's off a little bit because you're not, especially if you find yourself, I'm trying to slow myself down because I have like a lot of things to say that I want to say about this. And trying to remember it all as well. So when you are doing the billing and you don't have to worry about all of the code selections and things like that, you can start to learn it little by little. This is good for people who have gone through fast-paced medical coding programs, or they feel like they didn't get enough training, which is always possible. And if they don't feel like they got enough training, then they would just, you know, start off as a biller, and that's a great place to start, because then things will start to make sense when you're in the real world and you get it. Okay, now if you start off as a coder, okay, you can start off as a coder even though you have no experience. Even though they say they want 3 to 5 years experience anyway, you're still going to apply anyway. Do not comment, everybody wants experience. I just told you to apply anyway. If happy coders are in that area, they are going to stay. That employer is going to need coders, and they're going to get to the point where they're in a pinch and they're going to need somebody. So they're going to take whoever's applying. And if you show up and you tell them, hey, this is what I can do, and you take their assessment test and you pass, or that you pass close enough where they know that you just need a little bit of support, you know, that's how you can get your first job and you can get your foot in the door. Okay, but it doesn't happen if you are sitting and saying, oh no, it doesn't say entry level. It says that I need 3 to 5 years experience. Just apply anyway, okay? Apply anyway, and that's how people get their jobs, all right? But if you're starting off in the coding, now again, you're gonna have to look at this record, and you're gonna have to decide what codes to select if the codes aren't already selected, or if the codes that are selected are incorrect. And you can do this. You can absolutely do this. If you've passed the medical coding certification exam, you absolutely can code. It's just a matter of getting practice, okay? And another thing, when you're starting off, a lot of times these employers will have you do what's called a pre-bill. Now, a pre-bill is when they will give you a set amount of records, like 50 records, all right? And you code them in batches of 10. So you code 10 encounters at a time, and you turn them in to the lead medical coder or the supervisor, whoever you're reporting to. And they do a 100% audit before, and they check to make sure that you're coding everything like you should. And if everything is good, then those claims get submitted. If they are not good, then they can find out what is troubling you and where you need help and support. And you have to get over a certain amount passing scores on these records, so that way they can just let you, start coding after those 50 that you code. But if you end up not doing so well in those 50 and they still have to kind of like watch you a little bit, they'll give you another 50. So again, everybody does it a little differently. But when I worked at home, working remotely for a level 1 trauma hospital, that's what they did. They gave me a batch of 50. I coded those 50, and then I was out, and I was coding. But some of the other girls that got hired behind me, they got 50, didn't do so well. And then they got another 50, still didn't do well. And then they got another 50. And then some of them were able to stay, but others, they had to let them go because they had time to get with them and they still weren't getting it. I always say when I worked at home, it was like the Marine Corps of coding. So I think that's part of the reason why I'm not afraid of anything anymore, because that place was very tough. I learned a lot while I was there, but that's the thing, guys. But again, back to the coding. If you are doing that's your first job out, it is possible to do that. But again, you're reviewing the documentation, you're selecting the codes, entering them into the system, and then sending it off. Sometimes it will automatically get filtered to the medical biller. The medical biller will do what they need to do to process the claim and then send it off to the insurance to be paid. All right. So that's the main thing of what we do. We code these encounters that come in. And it depends on where you're coding at. For some people, they code for the ER, which is fantastic if that's your first job as a coder. I always say working in the ER, working professional fee coding, meaning that the patient is staying in-house and you're coding for the professional fee services for the outpatient side, right? That's always best to start with. Neoplasm coding is also really great to start with. Orthopedic coding is also another fantastic place to start. These 4 places will give you a lot of variety in the coding especially, and so it'll make you not afraid. So I'm just saying. But again, depending on where you're starting in your coding, some people will start off in the ER, and when they do that, they're coding for the procedures like the hydrations and things like that they do. Sometimes they do minor procedures, and sometimes they do fracture treatments or dislocation manipulations. I mean, it really all depends, where you're at. So all of those things aside, you're doing the coding. The other task that we do as coders is to educate our providers. Now, again, like I said in the beginning, it depends on if at your facility, if they have a coding educator. Some places do, but a lot of places do not. If it is your responsibility to do the coding education, then you would have to come up with a slide deck. You would have to come up with some kind of plan that you're going to train them and things like that. Now, I've done videos before about doing provider training. It's really it's one of my most favorite tasks to do as a coder is to do provider training. It is a lot of fun. And please spare me if you're saying, oh no, I'm shy. I'm shy too. Believe it or not. I am a shy person too. But when you enjoy what you do, you'll find that it will do wonders for your energy. It will do wonders for your shyness, kind of put that to the side because you're doing what you enjoy. All right. And it's all about preparedness and preparing yourself to speak to people and preparing yourself to know what to anticipate And there's a lot to that, all right? But coding education is one of the things that we do. Again, not all coders do it, but it is something that coders do need to know how to do, all right? And again, don't panic. If this is your first time out, it's okay. Everybody had their first time out. And it's not anything to be so, worried about, because it is a fun thing to do, all right? So that aside, of course, I talked about the queries and how sometimes you have to send email queries and things like that. You always want to make sure that your queries are written properly, that you're writing in appropriate grammar and English and things like that, because there's nothing worse than getting an email from a coder and it's written horribly. There's no excuse for that, especially when there's so many things that can help you to write really well. And that's just my advice anyway. You always want to use proper grammar. I don't know what it is about this generation that's coming up that they think that it's appropriate to put the first letter of somebody's name in a lowercase. I don't understand that, and that's a shame, okay? First letter of somebody's name needs to be capitalized, and I cannot believe I have to say that. First letter of somebody's name needs to be capitalized, and the same thing for their last name, all right? You're addressing them. You want to make sure that you're addressing them appropriately, all right? So that's the other thing that we have to do. But any of these other tasks, any of these other supplemental tasks, they're asking you to do too much. And they will try to squeeze every bit of labor that they can out of you if you let them. So again, it goes back to making sure that you're applying for the appropriate job. I always tell coders, especially brand new coders, don't apply for secretarial positions or like the patient representative and things like that. Don't apply for those positions because they do not use your skills as a coder. And if they do, if you're doing a secretarial position, that's a shame. Why? Because you are being paid to be a secretary. You are not being paid to be a coder in that position, because a coder is responsible for making sure that all the appropriate codes are selected. Yes, but what happens with those codes? That's how the provider gets paid. Is that something a secretary does? No. A secretary is going to make sure that the patients are there, they're checked in, they're doing everything they're supposed to do, that their calendar is being, the provider's calendar is being managed. That's what they do. That's that administrative side. You as a coder are responsible for the financial side. And that's something that has to be concentrated on by itself, not including all these other tasks. If you're doing all these other tasks, I hope you're being paid really well. I hope you're being paid really well, because I see that from some people too. They write to me and tell me, oh, Blue, I just got this fantastic opportunity. I'm working at this doctor's office and I'm working as a secretary. And they said that they're going to let me do the coding. Excuse me? They're going to let you do the coding? Yeah, and then they really need my help, and but you're still a secretary. Are they paying you like a coder? Well, no, but this is so that I can gain experience. No, they're taking advantage now, because why should they make you a coder when they can pay you as a secretary and they don't have to worry about it, and they can get all this other labor out of you too? Guys, y'all have to think about this stuff, because they will try to use you for every single thing that they can. Make sure that you are being in a job that's going to give you that experience, or it is going to lead you on that path. Prior authorizations, medical billing, a claims reviewer, right? For the insurance. Sometimes they hire claims reviewers to deny claims and things like that. If you're a brand new coder and they're obviously going to have you running this stuff through basically an encoder to see where the edits are coming from, and then you go in and then you put in, hey, this is denied because of this code, and that's what you send back to the doctor's office. I always call that working for the dark side. But with that said, those things are going to prepare you for being in a job as a medical coder, not being a medical secretary, not being a patient access or patient representative or any of those things. You're not coding in those positions. Those positions are not meant to be coders. And if they are making you do the coding, or if they're saying that, yeah, you can get experience, you got to be careful with that. Because even though they say, oh yeah, you know, we'll write a letter for you that you do all this experience and things like that. Do you think when push comes to shove that they're really going to let you go so easily when you've been doing all of this work basically for free? Think about that. Just think about it. So with that said, I'm going to go ahead and wrap this one up. But yes, stay away from those jobs where they're asking you to do all these other extra things. There are some instances where, yes, it's okay to do a little couple of extra things, but it really needs to be concentrated on coding. Do not get taken advantage of, like where they're saying that they want you to do all these things, because no. And if they say, well, we can't afford it, you're a doctor's office. You're a hospital. You can afford it. If you can't afford it, it's because they're not balancing the budget in there somewhere. And that's a whole nother problem that has nothing to do with you. You need to go to a place where they're going to appreciate you. That's all I'm going to say. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.